Good morning, everybody. Respected Dr. Ramajam, other dignitaries and friends, ladies and gentlemen. For a specific cause, creating awareness about rare disease. This year theme is ophthalmology. Friends, myself as an eye specialist working for a rare disease for about last 40 years, of which first 6 years was my training at All India Institute of Medical Sciences. You know, behind this interest for rare disease of congenital glaucoma lies two things, one institute and an individual. Institute is All India Institute of Medical Science Ophthalmology Department, Dr. Rajendra Prasad Center for Ophthalmic Sciences, and my mentor, Professor Anil Sood. I have a 3-minute video for Professor Sood, and that I will present at the end of my presentation. What I will do in my brief presentation is a broad overview of my work, my learning, and my work over the last 40 years. Primary congenital glaucoma is a rare disease, so rare that it is said an average ophthalmologist may see a case of newborn glaucoma or congenital glaucoma in 5 years of practice. A general practitioner may see a case in his lifetime, so rare. If we go into the literature in the Western countries, Western literature, the disease is prevalent 1 in 10,000 to 1 in 30,000 live births. But population-based study conducted by L.V. Prasad Eye Institute, we realized that the disease is much more prevalent in the southern part of India, 1 in 3,300 live births. That is 8 to 10 times more common than the Western counterpart. And it is responsible for 4.2% of blindness in India. So, a healthy child, but even though the child appears healthy, the family, the parents expect a healthy child. But look at the situation, if the child is born with this condition, the scenario changes dramatically. There are two things as devastating to the parents as the knowledge that they have produced a defective child with developmental glaucoma. All the hopes for perpetuation and fulfillment of their own lives are shattered, and there inevitably follows a nagging sense of guilt that in some way they have been punished. Family tension mounts as they focus blame on each other, and the unconscious desire to reject the child is in constant conflict with the certain knowledge that it is their responsibility to love him and to accept him. Blindness is becoming a social problem, sharply impinging on the conscience even of the developing world. Aware that more than half of the children now blind need not have lost their sight or could have had their visual disabilities corrected. Society can no longer ease its concern by offering the old medium of income, nor by the more modern methods of pension and relief. Even if a child is incurably blind, he or she still has equal social rights and economic possibilities that must be realized and fulfilled. This calls for the clarification of many aspects of blindness and the determination of the measure of the society's responsibility for this segment of the world's population which labors under the handicap of visual impairment. If the tears of this little child move you, they are a window open onto the sea, for what you feel are not merely the tears of this one child, but of all children. I dreamt that I could dedicate my life for caring for the children and started working on this disease independently only after joining L.V. Prasad Eye Institute in the year 1990, to be very specific, 22nd August 1990. I'd like to share my experiences with you. The more we share, the more we have in this case is so true. As late as 1939, Anderson saw little hope of useful vision in the children despite the detailed evaluation of all known treatment modalities available at that time. He quoted Seefelder in saying that I know of no case of operated hydrophthalmia where undiminished sight has been retained till the later life. Anderson in his textbook further wrote, the future of children with hydrophthalmia is big, little hope of preserving sufficient sight to permit the earning of a livelihood that can be held out to them. It progresses as a rule in a relentless fashion until the best setting for the patient is some institution that caters for the blind. But this very prognosis of congenital glaucoma has changed dramatically. Pivotal to this new philosophy about developmental glaucoma is early diagnosis and prompt microsurgical intervention. The picture you see here, the child was brought to us at L.V. Prasad Eye Institute in the year 1993, and the father was an optometrist actually. In spite of my explanation that the milder form of the disease, the child should be okay, there was failure on my part. I could not elicit smile on the parents of in the face of the parents. I requested them to capture that moment, and so I told them that after 2 months after the operation, the child will see and he will smile automatically. I don't have to provoke. The same thing happened 2 months post-operative. The parents came with smiling face. I followed up this child, now lady, for about 35 years. And here is 25 years picture. I'll come to the other story later on, part of this story later on. I happened to be the very ceremony of this girl, and it was a nice feeling for me. Now, you know, the picture is like this. It's primarily a surgical disease. Medical therapy has accorded a supporting role only, and the surgery should be performed at an early age as possible. In my lifetime, I have operated more than 5,000 children, of which several children have been operated within a week. This is the child who was operated at 3 days of birth. Before 1938, there was no surgery described. Invariable outcome is blindness. Several surgical techniques came. The first technique described by Otto Barker in the year 1938. After that, several such surgical technique improvement happened and the prognosis improved. In the year 2022, we published an improved surgical technique in my name. So here are the dignitaries who have contributed so much about the congenital glaucoma management. The lower picture, my mentor, Professor Anil, from whom I learned the science and art of taking care of the children with congenital glaucoma. His invention, path-breaking surgical technique, primary combined trabeculotomy, trabeculectomy, is the way to go. Several of his students and I'll say fellows are now doing this technique, and this technique has been the most popular technique or the most appropriate technique for most of the patients we see in India. Here is a child brought to us at the age of 3 months. You can see the left eye of the child is afflicted with sudden corneal clouding, infantile onset glaucoma, emergency situation. We operated on the child, and the lower picture shows the cornea cleared and the child is doing very well. This is story of 2011, and I am still following up the child. The child is studying 10th standard.
Catching my gaze with limpid eyes
of the child.
in mother's arms, he refuses to see. appealing eyes, he speaks the language of his soul. The faces lit up with smiles, a radiant beam on the baby's face. Each little one, not a patient, but like my own child does seem. These little gems are tomorrow's dreams. I cherish their budding dreams.
So we published several reports on primary surgery. When primary surgery fails, second surgery, we do, some of the patients will require multiple surgical intervention. Not just glaucoma surgery, sometimes the patient will require penetrating keratoplasty. With Dr. Muralidhar, we have done several hundred patients who are actually undergoing keratoplasty surgery after normalization of intraocular pressure by glaucoma surgery. And this is for the first time in 1990, the textbook mentioned about our work and the surgical technique came into the textbook. I'm not going into the details, but just telling this is first 21 year, we have operated on 1128 eyes of 653 children and results are satisfactory. In the recent 13 years, result has been reported 2011 to 2023 and 704 children, 1150 eyes. Taken together, these two papers, this is the world's largest series on congenital glaucoma. A series of patients who were operated in the first decade of my work at L.B. Prasad Eye Institute were followed up for at least 20 years and the results were satisfactory. One such patient here, we came to know that about one-third of the patient will have good vision, fair vision in 16% and a significant percentage, almost one-third to one-half of the patient will require some form of visual rehabilitation. I'll come to it. Over a period of years, we have developed an integrated approach for holistic care of the affected children and their families, integrating medical, surgical, genetic and rehabilitation approach. Understanding the impact of congenital glaucoma on the quality of life of the affected children and their families, we worked sincerely and published several papers. First aim is to restore corneal clarity, next is to improve visual function, and our final goal is to maximize quality of life of the affected children. Of the papers published in the world literature, a review article published in the year 2023 from India, largest number of papers are published, 8 papers of which 7 are from our group in the L.B. Prasad Eye Institute. Quality of life and life satisfaction in children with primary congenital glaucoma who had operated within few days to few months of birth. We understood the importance and the need for education and in the continued care of these patients. These are the professional achievement or the educational achievement of the children. I'll come to it later on. A significant percentage of patients will be victim of visual impairment or even total blindness. Even though we know we cannot do much about the child for his vision or for eye treatment, lot of things, we should never say that nothing can be done. Lot of things can be done and must be done, if not for the eye, at least for the child as a whole. Providing rehabilitation services to our visually impaired children is the medical, moral, and will likely soon become the legal responsibility of all ophthalmologists. It is no more acceptable for an ophthalmologist to abandon a child once the medical or the surgical treatment is completed, but before the needed rehabilitation services have been provided. Then it would be for an orthopedic surgeon to abandon an amputee to hopping around on one leg. But the difference is that the common public knowledge would condemn an orthopedist who acted in this way, whereas similar deficiency in the ophthalmic field is not yet so apparent to the layman. The ophthalmologist must either provide these services or refer the child to someone who does. There are several questions of social concern. Social concern for the problems of blindness and its alleviation cannot ease only with full understanding of the medical aspects and the possibilities of cures and preventives. but should seek to culminate in the rehabilitation of the children involved and to aim at their restoration to society as contributing members. While workers for the blind need to understand more fully the medical aspects of their rehabilitation clients, medical men must come to know and to accept the economic possibilities of the blind children. But with the progress that has already been made, it may not be too much to hope that medical research combined with physical rehabilitation and social acceptance will bring fulfillment of the words of the Old Testament. I'll bring the blind by a way they knew not. I'll lead them in paths which they have not known. I'll make darkness light before them and crooked places straight. These things will I do and not forsake them. In the best scenario, we have several of my operated children doing medicine. 16 are doctors, of which 8 are postgraduate doctors, and some are doing medicine and some entered medicine in the last year. 7 PhD, 13 dentists, 1 optometrist, and several others are doing profession like teacher, engineer, lawyer, computer science, cyber security, journalist, and chartered accountant, etc. Here is a child. We operated at the age of 1 month, and the child did medicine, completed MBBS from Osmania University, and she is doing medical officer post in Hyderabad only. Several other children have done, dentistry, the internal medicine specialist, surgery, dermatologist, psychiatrist, etc. In the last year, 4 of my operated children entered medicine. Here you see a child operated at the age of 1 week, first year MBBS. Again, another child, first year MBBS. The younger, sister of the previous child I saw is doing second year MBBS. She is not a patient, but the sister of the patient doing second year MBBS in Lady Harding Medical College. This is the best case scenario. In the other end of the spectrum, there are some children who are actually totally blind or severe form of visual impairment is there. The child you see here, actually the son and daughter of a couple, both had congenital glaucoma and both were operated multiple times. The vision of the boy, when I saw at the age of 8 years, there was no perception of light in both eyes, totally blind. And the younger, sister had some vision. With that she was continuing medicine. Now she completed graduation, doing job. But it so happened, we explained the situation to the parents, referred the parents to our rehabilitation department, and daily living tasks, computer training, etc. had been taught to the child. The child did industrial engineering from Dubai, and after that he did, beating all the normally cited peers. She came, she was the topper in the batch, and he did 1 year industrial, engineering training from London, and he is now Barclays Bank employee. Very important thing. I had an opportunity to talk on this subject in London in UK Pediatric Glaucoma Society meeting in 2019. I requested the organizers to call him because he is in London, and he came, he spoke on this occasion, which was highly appreciated about his lifetime work, how he cope up with the situation and leading a very fruitful life. Here is the person, UK National Champion in Blind Tennis 2021 and 22, and World #1 tennis champion in the blind category, happened to occur in Birmingham in the year 2023. Just to tell with the permission, I had the permission from the parents and the family, The child got married, the man got married to a medical student, now doctor, perfectly normal person, and they are settled in UK. The other example here, a man whom I saw when one eye was lost, right eye, left eye had some vision. We operated on the child to control the pressure of the eye, and then the child required penetrating keratoplasty, which was done in L.V. Prasad Eye Institute. We were following up this boy for a long time, but it so happened that in a marriage ceremony crowd, he is only seeing eye was injured with the elbow of another person, and he lost vision totally. In spite of all attempt, we could not do much, we could not save the vision. This is the situation. Here is the situation. I know right eye having prosthetic eye, left eye having thumbsical eye. He was a good athlete. He continued his interest for that and learned swimming, sea swimming, cycling, and running with the help of his coach. The coaching was done in Pune. He appeared for the competition, triathlon race in triathlon in Dubai, and he was the first Ironman of the blind category. I am following him since he is 2 years of age, and he is now about 40 plus. He runs a company of different kinds of masala. He about 25 people used to help him in the small company. One of his conversation with me, I am reminded of. He said that doctor, life has become so busy that sometimes I forget that I am blind. I do not have any vision. He is married. He has one child. The child completed 10th standard and studying further. So these are the two patients, two extremes. One side, very good vision, and other side, absolutely no vision, and other patients lies in between. Here is an example. At the age of 2 weeks, we operated on this newborn girl, and the girl is doing very well, doing job now, 27 years of follow-up. Simultaneous bilateral surgery or surgery on both the eyes in the same operative session was done. The child which photograph I showed, I attended the marriage ceremony. There is 31-year follow-up, just with a baby boy. I'll come to it further. I had an opportunity to follow few patients of my mentor, which I happened to see along with my mentor at the All India Institute of Medical Sciences. Here is such a child from Hyderabad, came at the age of 6 months. I have attended the marriage ceremony of this boy, and the couple is now parents of two children, one boy and a girl. And here is the situation. And the child completed about 38 years of follow-up. Another child, these are the two children actually who inspired me to concentrate on this rare disease. When I was studying my fellowship with Professor N.N. Sood. The girl operated at the age of again 6 months from Aurangabad, and is doing very well. Completed MBA and looking after her father's business. Here is the couple and the children. One girl and the boy, both are all right, not afflicted with any disease. Completed about 37 years of follow-up. So I have had occasion to express my experience or sharing my experience on different occasions, try to create awareness of this rare disease, congenital glaucoma. We used to train people to transfer this skill and the microsurgical skill in the L.V. Prasad Eye Institute for 35 years. I have been now working in Center for Sight and trying to do the same job, transferring this skill to the next generation. Inspire the next, Professor N.N. Sood's son was our first fellow. In the picture you see here in your left, Dr. Devendra Sood, he is working in Delhi, and in the other side, right side, Devashish Chakraborty who was trained very well and is working in an eye institute in actually Center for Sight, Kolkata. Several, all the people did fellowship with us. Our idea, our motto is to transfer the skill and make them ready for the to carry forward the work. So this is, we created a parent support group to create public awareness, and we used to meet every year and the discussion to create the awareness. Here is our contribution for the care of children with PCG, holistic care, and others are listed here. And the last point is innovation, new surgical technique we created. I'm not really surgical technique here. It will be presented. So this is our scorecard over all the published literature in the English language starting from 1955 to 2022. Whatever published papers on childhood glaucoma was there were analyzed bibliographically, and L.V. Prasad is in the top, and with immense pride and humility I submit that my name came in the top. So I'll come to it later on. It's an institutional work, it's a group work. I happen to be the main surgeon for these children. As I told, we created a situation where holistic care of the children is done. A few words about investing for children for PCG with a better future. Perhaps the most important investment for a person to the society is to create awareness about the disease. We used to tell that the children are our future. A child delegate in 2002 United Nations Special Assembly commented that you call us the future, but we are also the present. Friends, children, our greatest inspiration for the present and best hope for the future. We are guilty of many errors and many faults, but our worst crime is abandoning the children, neglecting the fountain of life. Many of the things we need can wait. The child cannot. Right now is the time. His bones are being formed, his blood is being made, and his senses are being developed. To him, we cannot answer tomorrow. His name is today. Unless we pay attention to the needs of our children, our future is in jeopardy. On recognizing the problems of life in this planet, we must recognize that one of our problems is related to providing our children with every opportunity to develop. To do anything, they must have a sharp and lasting vision. When judging the seriousness of problem of blindness from a social point of view, we should not base our opinion on the number of blind, but rather evaluate the importance of the question on the basis of number of years in which the blindness persists. Or in other words, to properly assess the financial and the much larger emotional burden of blindness, one must recognize that the blindness, if we cannot do for the eye or vision, at least we should do something for the rehabilitation of the children, and to bring the children to the mainstream so that each and every afflicted child will be a contributory member of our society. You know, the way we are doing integrated approach will go a long way, which will improve the quality of care we provide to the child, to the family, which will translate into quality of life of the afflicted children and their families. Here is a child operated by me during third year MBBS. I have yet to see or influence a child to do medicine. This boy says that he wants to do medicine, wants to do ophthalmology, and wants to take care in the care of the children with glaucoma. Let's see. So, I was talking about this child. Here is the photograph. The couple are now parents of 2 children. They are happy, things are doing very well. We are very fortunate here in Hyderabad, in India, in Hyderabad, and at the L.V. Prasad Institute. Dr. Rao created the institute, created an excellence of to foster the climate of excellence. Excellence being a journey, not a destination. We are very happy that I would like to express my profound gratitude to all the members of the healthcare team at Anil Kumar Institute who have contributed to our knowledge on pediatric glaucoma. I have learned so very much from my faculty colleagues and friends, and particularly from the fellows and residents who have contributed in a most profound and beneficial way to the academic environment existing at the Anil Kumar Institute over the decades. And yes, whatever I told or whatever story I am sharing with you is not from an individual. I have done my part, happened to be the main surgeon for the children with glaucoma, but I have learned so many things from the other members of the team, the nurses, the anesthetists, the pediatricians, the other support staff who have helped me along the way. Lastly, I would like to express my profound gratitude to Professor Sood. Professor Sood is an excellent teacher, a teacher par excellence, and an excellent surgeon. I'll present a small video on him, and this is the video. 3-minute video.
A few words about surgery, surgeon, assistant, learning, teaching, experience and wisdom. I believe surgeons are made. A masterful, competent, ingenious, deft and contemplative surgeon is made and not born. Friends, basic surgical skill rises from innate manual ability, expanded in training and perfected in experience. I believe our learning is incomplete if we cannot transfer the skill to the next generation of professionals. Our aim is to train 3H ophthalmologists. 3H stands for hands, head and heart. Essentially, it means that the surgery will be performed by skillful hands with good judgment from the head and of course with cordial involvement from the heart. The idea is to produce wholesome ophthalmologists for holistic care with humanistic approach. Surgical style is the expression of personality and training exhibited by the movements of the fingers and instruments. Its hallmarks are dexterity and gentleness. As a surgeon, you should practice and observe highest level of gentleness and tissue respect all throughout the surgical technique. I am grateful to Professor Sood, and he literally taught the surgery by catching my hands. I am always grateful to Professor Sood for his support and for the many opportunities he made available to me. Professor Sood is a teacher par excellence, an orator of rarity, a writer of an unusual grace, and a complete artist as a surgeon and a deeply religious man. I shall say in no uncertain terms that I owe to Professor Sood all my professional skill, for he is my Guruji with an unflinching stewardship, erudition and expertise, and above all, human qualities as a person. My salutation to Professor N.N. Sood, the noble Guru who has opened my eyes, blinded by darkness of ignorance with the collodium stick of knowledge. To him, we pray. Om Ajnanotimirandhasya Gyananjana Shalakaya Chakshurunmilitam Yena Tasmai Shri Gurave Namah. We should be able to try our best to transfer the knowledge, attitude and the philosophy of management of childhood glaucoma to the next generation of professionals.
So that all may see and every eye deserves the best. Friends, ladies and gentlemen, in my presentation I have said I, me, myself, all should be replaced by we, ourselves, etc. It's a teamwork. I respect and credit all the members of the healthcare team. So the fact is, when I is replaced by we, illness will convert into wellness. In this respect, I will quote few lines from Tagore. Oh, now beneath your feet dust, let my head kneel on the ground. Yield down my arrogance to tears. Let me not advertise myself in various things I do, but let my deeds feed your desire that your will may come true. Oh, for your true peace is my longing, and your dear images belonging within my heart of locus fatal. May your seal be found. Yield down my arrogance to tears, let all my pride be drowned. Thank you.